it's been shown in many settings that a good palliative care network that reaches from the hospital to community health center to the home can save money for healthcare systems by reducing the need for admissions to hospital, by reducing length of stay in hospital. So a first point is that by implementing palliative care, it's not necessarily taking money away from other health programs. It can actually make more money available by saving money, as well as providing financial risk protection for patients' families. Palliative care is an ethical responsibility of health systems, and it's an ethical responsibility of healthcare personnel to provide relief of suffering. So it's not optional. It's an ethical responsibility to fulfill the human right to palliative care. There needs to be affirmation by the government through policies, ideally a specific policy on palliative care or an integration of palliative care into national cancer control planning, for example, national non-communicable disease strategic planning, and there can be advocacy for this. There needs to be essential palliative medicines, very inexpensive, the most important of which is oral immediate release morphine. There cannot be a credible palliative care program without oral immediate release morphine. And there needs to be access to this for anyone who has pain or anyone who has a medical need for morphine, balanced by great care to minimize the risk of diversion of opioid for illegal use. So a secure supply chain, but also access to morphine by anyone in need. There needs to be training. So another place to begin is with training of nurses, training of doctors, integration of training in palliative care into medical school curricula, into nursing school curricula, into training for general practitioners who are going to staff rural health clinics, making it obligatory to have training in palliative care, and also trying to arrange for 1 or 2 doctors and, if possible, also nurses to get advanced training in palliative care outside the country if it's not available in the country. And finally, where most of the patients are is in a home, so training for community health workers to be able to recognize problems. Where to start depends on the country and depends on the specific situation. I think it can be useful to work both from the top level down and the bottom level up. I think, as I mentioned, it's important to have expertise in palliative care. So a physician who has advanced training and can train others, train other doctors, train nurses, who then can also train others. And such a physician with specialist training typically works at an upper level hospital or referral center. But there also needs to be palliative care services available at provincial or district level. Maybe nurses and physicians who are not full-time, or maybe a full-time nurse and 1 or 2 part-time doctors, depending on the size of the hospital and the community served. At community health centers, nurses with basic training in palliative care, or also in some cases physicians if they're staffed, if community health centers are staffed by physicians. And then very important to make sure care is available where most patients are, which is at home. Community health workers who don't necessarily need to have a lot of training, but enough to recognize when pain is not well controlled, when there are patients whose symptoms are not well controlled, and to be able to report that to a nurse at a community health center, so that the problem can be handled in the community and the patient doesn't have to go back to the hospital with all the costs associated with going back to the hospital, not only for the patient but also for the family. any of those places are a place to start. And it's hard to do everything at the same time, but any of those places are places to start, and there are plenty of materials available from WHO, from other organizations, the International Association of Hospice and Palliative Care, the African Palliative Care Association. There are lots of materials to guide how to start and where to start and how to implement palliative care.